Okay, so today I'm going to go over a little bit more about ribs. You guys did an excellent job on all of your projects, but I figured I would clarify a couple of things. So several of you made the mistake of doing a bilateral AP or PA projection when we had a unilateral injury. So again, if they had a left upper posterior injury, you're going to make sure that one, the injury is closest to the board. So in this case, she would be lined up for an AP projection. And you can tell that I've centered over her left side. So I'm going to center somewhere in between her mid-sagittal, so right at the sternum, to the lateral border of her body. And of course, I'm going to center at the level of T7. So you guys did an excellent job with that. Good job. I'm going to make sure I put my marker right up here in the corner. And we're going to do some proper breathing instructions, right? So take a deep breath in, blow it out, take another deep breath in, and hold it, right? So good job. Breathe and relax. So that's what you want to do if you have, a left upper posterior injury, is that's going to be your first picture. Now your second picture, you're going to do the LPO position. So I'm going to rotate her 45 degrees, about like that, in order to do the oblique. Now I want to make sure I also take into consideration her arm. So I want her arm to be as away from her rib cage as possible, so that there isn't going to be anything that gets superimposed. So once I've made this adjustment, I'm going to give her those same breathing instructions. Take a deep breath in, blow it out, take another deep breath in, and hold it. Okay? Breathe and relax. Good. You can let your arm relax. So those two images make up the routine for the left upper posterior injury. Now, she had an anterior injury. We're going to switch sides. We're going to go to her right side. She's going to turn around for me. Turn around. Keep going. All right, so this time, I'm going to make sure that I center right in between the spinal column and her lateral edge of the body. So move a little bit more that way. Perfect. Now, same thing, I want to make sure, so now we're going to assume that she has a right upper anterior injury. So we want that to be close to the board. And I'm going to have her take a deep breath in, blow it out, take another deep breath in, and hold it. And then breathe and relax. Good. So, again, my marker would be up here in this corner. It would be the right marker because this is her right side. Okay? Now, this is the tricky part, and where some of you also got a little bit confused. We're going to do an LAO position, but I'm still going to center over this right side because that's my side of interest. Now, I know that I told you want the side or the injury to be close to the board, but this is the one exception to that. Okay? So again, I'm going to make sure I recenter a little bit, not leave obliques, so that I still get the right side. And again, moving the arm out of the way. Okay? So, now that I've taken care of that, again, deep breath in, blow it out, then a deep breath in, and hold. Okay, breathe and relax. Notice, that because of this distance, I didn't change my collimation at all. She's still the same size that she was before, but I'm not going to see that extra little edge because of the magnification, So that distance means that my light disappeared. But I know, that I'm going to still cover everything. So just because she went away a little bit and my light out here that I can see changed, I know that because of divergence, I'm still going to get everything I need. That didn't change. So again, just remember that when you're doing your positioning, okay? The other thing about that, and I know some of you are probably wondering, and yes, some physicians will ask for a bilateral AP or PA projection for a unilateral rib injury. Fine, you can do that. But for our purposes, I wanted to keep it unilateral because we always try to minimize dose. Okay? So again, if the injury was unilateral, we keep our images unilateral unless otherwise specified by the physician. Okay? All right, so that was it for the ribs. Just a couple clarifying points. And yeah, don't mind my ghetto-tastic face mask. This is my protective gown, right? This is my version of being PPE compliant-ish, best that I can. There we go. All right. So, also note that I kept my source to image distance at 40 inches. Now, I know some of you guys have used 72, and that's fine, but beware your technique, okay? So at 40 inches, I would put my technique somewhere in the high teens to maybe 20, depending on what I was using, what kind of equipment I was using. Now, if I had increased my distance, I'm definitely going to increase my kV, and I'm going to have to increase my mass. So think about that and make sure that you understand what your SID is when you are making the decision about your technique, okay? All right, so that being said, we're now going to move on to the sternum. So you're going to turn and face me. We're going to start with the lateral, because that one's going to be a little bit easier for you guys. And remember that we're going to move our centering down just... No, actually we're not going to move our centering. I lied. Just kidding. We're going to keep our centering the same, okay? But I do want to back it up to 72. So I'm going to have to readjust. It's around here somewhere, I swear. Okay. So now that I've readjusted my collimation, this is going to be the fun part for the patient here. They're going to make sure that they put their arms behind their back. Good. And again, nice and close, and back up for me just a little bit. Okay, so the idea is that you kind of want to skim the chest, right? Because that's the bone that we're looking for, is the sternum here. And you want to do your best, right, with those arms behind you to get as much anatomy out of the way as possible, okay? Again, I'm going to make sure I put my marker here. I'm going to make sure that they're stable so they don't sway. And I'm going to just have them hold their breath. Now, if they're having trouble, it's best to have them hold their breath again on that inspiration. So again, we'll further put their sternum kind of away from the other anatomy. So again, take a deep breath in, hold it, and that would be my image. You can really relax. Okay? So again, the idea is that you want to make sure you've covered, right, the area of the sternum. So you want all the way from the jugular notch down to the xiphoid tip, which can be difficult to palpate on certain patients. But like I said, you can kind of figure out where your centering point is, then it's going to be easy to go from there. All right, the next picture in the routine is that you do an RAO. So you can turn and face this again. You can relax your arms down by your sides. We're going to do a very slight, about 15 degrees. Now, this is where you would move back to 40 inches. Because this time the magnification will work in your favor. So again, I'm going to open up to somewhere between 14 and 12 and about 7 wide for my collimation. And I'm going to want to make sure that I center just off the spine. Okay? So again, right here's her spine. And I'm about 2 inches right? My 3 fingers off to the side in order to project, right, her sternum into her heart shadow. Okay. Again, you probably want to put a right up here, so you have the marker, and we want to do a breathing technique this time. So again, I'm going to make sure that I have a very low MA station, but a very high time, right? If I'm going to use a breathing technique, I want it to be at least 2 to 3 seconds, so it's going to seem like a really long time. So when I'm over here doing my beeps, right, which I haven't really been doing, so sorry about that. I want her to keep breathing. I'm going to give her those instructions, right? So just keep breathing normally, and I'm going to stand over here and go beep, right for 3 seconds, okay? And that's going to allow you to blur out the ribs, and you should be able to see the sternum in that heart shadow a little bit clearly, at least as best that you can. All right, thank you, patient. You can relax. So hopefully that will help clear up a couple of things about the ribs, and now that you've seen the sternum demonstrated as best that we can, you'll know a little bit more about that when you get back to clinic. I did confirm today with Connie that the SC joints are actually not on the registry anymore. I thought they were, but just kidding, they're not. So even though we went over them in lecture, I'm not going to go over them in lab. So you're off the hook for one. Can't think of anything else. So I think that concludes our lab experience for this week. Till next time.